Thank you for coming here. Thank you for agreeing to give this talk, and we're all looking forward to it. So I'm just going to ask a couple questions. Of course, they relate to kids.
Yeah.
So we could talk about a number of different things with kids, but let me just tell you one of the projects that we're working on here, and I'll just ask your advice. It's in the preschool arena, and we're about to get funding, I hope, for an RCT with oral health. So many kids in our state, it may be yours too, but ours in particular down along the border, that are low income and although they have Medicaid ability to go see the dentist, there's not enough dental providers, and they live far away. So we've seen a really high rate of cavities in teeth, which of course is a nutrition related problem. It's one very close to the obesity problem we've been working on. So anyway, what sort of best practices would you think of about helping moms and dads, probably moms more than dads, work with young kids in preschool about the types of candy and food they eat that might either make them more likely to be obese or to have oral health problems?
Well, I'm going to respond to you. I agree. Oral health is an important issue, and it affects certain segments of the population more than others.
Yeah.
But because we do a lot of our work through child care, we feel like that the first place to start is really right there in the child care program, which we believe also links to families.
Right.
And so we take an approach for environmental change, starting at the child care level, an organizational change. They need to examine what they're doing and conveying information to children and to families and what they're actually doing. So we spent some time working with colleagues in our school of dentistry. We have the benefit of having some public health dentistry in our school as well, and so we worked with a small group to actually define best practices for ECE around oral health. And it has to do with what we call provisions. What are they doing? Are they actually executing teeth brushing and a program of teeth brushing? What are they doing? How do they interact with the children around oral health and healthy eating practices? And then thirdly, what are their policies? Do they really define policies in this area? But a natural extension of the child care program is working with the families and really using what the center needs to be an example, though, and then convey. One of the most important things, of course, is brushing with fluoride toothpaste.
Right.
That is,
So what kind of child centers are you working with? Are they big ones, little ones, or all different kinds?
Well,
or
all
Head
different
Starts
kinds as well. But our oral health work is new, and so we've just released our oral health module. But we have a lot of resources also that go with that, so that can be used, and we've tried to aggregate sort of all those resources in one place, so the child care programs can have access to them.